Welcome to Muted in Medicine, the podcast where we break the silence on the untold stories and pressing issues within the healthcare professional. Join us as we dive deep into topics that often linger in the shadows of medical corridors and are not discussed in conferences, meetings, social gatherings, and in the hallways. They are often hiding. From navigating errors and facing litigation to the often overlooked realm of mental health among healthcare professionals. Through candid conversations and storytelling, we aim to amplify the voices and shed light on challenges that resonate across the medical landscape. So grab your stethoscope and a cup of coffee and tune in as we uncover the layers of complexity in the world of healthcare that are so muted yet so profoundly impactful.
Hello, everyone, and welcome to Muted in Medicine, a podcast where we break the silence on untold stories in healthcare. My name is Saba Fatima, and I'm your host for this podcast. I'm a pediatrician with a passion for helping healthcare professionals facing secondary trauma at work in healthcare, which often they're unprepared to face. If you're liking our content, please subscribe to our YouTube channel and give us a review on Apple or Spotify. Today's episode is a deeply personal one, about what happens when a physician becomes the parent of a child with complex needs. My guest, a cardiologist and a mother, shares her journey of navigating the healthcare system from both sides, as a doctor and as a mom. We talk about advocacy, exhaustion, and the growing challenges families face today, especially with the rise of misinformation and stigma around autism and other diagnoses. We also explore how this experiences changes the way she practices medicine, what empathy looks like when you've been on the other side of the exam table. My guest today is Dr. Umara Raza. She's a cardiologist at Baylor College of Medicine in Houston, Texas. Dr. Umara Raza, welcome to the show.
Thank you so much. It's a pleasure to be here.
We ask everybody when we start, what is bringing you joy in medicine today?
I work at the VA now, so the good work-life balance and serving a sector of the population that is often underserved, that brings me immense joy.
Yeah, okay, that's good. And you made that change recently, or you've been doing that for a while now?
No, I joined the VA 5 years ago, so it's not that recent, but recent.
Yeah. So getting into the topic, I want to know if you can share your story, tell us more about your children and what is like navigating your child's diagnosis and early journey. I don't think I know a lot of your stories. I would like to know.
Absolutely. So I'm blessed with two beautiful girls. My older one is Lena. She is now 12, and the younger one is Michelle. She's 9. And I was a third-year fellow when I was expecting Lena. And of course, like any other first-time parent, I was very excited, both me and my husband. And my pregnancy was quite uneventful, and I worked throughout my pregnancy. And I actually got into labor when I was in my echo lab. So I walked from my echo lab to the OBGYN clinic, and they admitted me. So everything was pretty streamlined. And Lena was born full term without any complications. So, when you have a newborn, they get the newborn hearing screen. So, she failed that hearing screen. And, the pediatrician who saw her, she was quite reassuring. She's like, I think she has fluid in her ears, so it's fine. It's going to be okay. Just get it rechecked in 3 months and everything's going to be okay. And honestly, I forgot about it. I came back home. We were very happy, of course, and overwhelmed with joy and a lot of hormonal changes. So I didn't think about it that much. But I do remember, I would like try to vacuum very close to her or clap close to her ears, and she wouldn't really blink. But I just attributed it to the fluid and just her being a neonate. I just had a month off after my delivery because I was encouraged to come back to work for multiple reasons. So I came back after a month, and then as were told, we made the appointment for the ABR for her when she was 3 months. And I distinctly remember that day. I was in the cath lab. I asked my co-fellow that I need to take my daughter to an appointment. I really need to go right now. And of course, I was in a male-dominated fellowship. I was the only female fellow, and they were like, "Why do you always have to leave?" But anyways, I went. My parents had brought her to the appointment, and my father dropped her off, and then it was me, the audiologist, and Lena, and she had the ABR, and the audiologist had she did the test, and she's like, "I'll be back in a minute," and she came, and then she went back, and she came back. She's like, I just want to let you know that actually your daughter she's profoundly severe to profoundly deaf. So I remember that moment because it felt like somebody had like punched me in the stomach, and I just felt really sick. That's probably the right word for it. And then I requested immediately that I need to speak to a physician right now. And she took me to a room, and ENT came and talked to me, and he just came in the room and just very matter-of-factly told me that my daughter is probably profoundly deaf and she will probably need cochlear implants in the future. And that information I actually don't remember what happened after that. I think it's just your mind's way of blocking out a lot of trauma, and I don't remember what happened the day after that, the week after that. A few weeks were kind of blur. Anyhow, when a child gets diagnosed with hearing loss and they are candidates for cochlear implants, they suddenly get put under the microscope. So she started having genetic evaluation, imaging. And as we went along, we found out that she had other diagnoses as well. She had low muscle tone. She had a vascular malformation. She was diagnosed with a syndrome called Waardenburg syndrome. So it was just, we went from being very happy. We weren't sad, but we were very stressed, very overwhelmed with emotions. And at the same time, both me and my husband were in training, right? So we were still going to work. I did not disclose this information to anyone at work because, I did my fellowship in 2010, so it was a long time ago. And, again, a lot of things have changed for fellows now, but back in the day, they were quite strict. You weren't allowed to skip a lot of days. You weren't allowed. So, and I didn't want to stand out in my fellowship. Like I said, it was a male-dominated fellowship, so I was the only female. I wanted to be strong. I wanted to be there. I wanted to be able to do what the guys were doing. So I just kept it all in. I was like, I just have a few more months left. I'll be done, and then I can take care of all of this. But I, sort of juggling everything. So how did I emotionally navigate it? It was, I kind of when your child gets diagnosed with special needs or gets any kind of diagnosis, especially when they're a newborn, it's like a death of a dream, right? So you have to go through those 5 stages of grief. And we did that, but you have to do that really fast because the window in which you can make sort of a difference in their lives is very short. Early intervention is important. So there were a lot of emotions, but then I got myself focused, and I was just like, she's going to succeed. I don't know what her success is going to look like, but she's going to succeed. So, we went from one diagnosis to the other, then developmental delays, then autism, one after the other. But after a lot of emotional upheaval, both me and my husband gathered our strength, and we are now lucky to have her, and we are her biggest advocates. She herself is her biggest advocate, but it was a very rough journey initially.
Yeah. And I think you shared it so beautifully, and I think it will resonate with a lot of people who are listening and, just talking about the grief, but then you also have to be there for your child because, they have no one to do those things for them, to advocate for them. So you have to be strong. And so I just love how you described it. How did being a doctor, sounds like both you and your husband are doctors, like how did that change? Because I feel like when you know even a little bit, you are thinking of the worst case scenario. And in that sense, the healthcare system, it can be a good thing and a bad thing. So what do you think? Was it a good thing or a bad thing?
I think it's a double-edged sword. It's a blessing, but it's also a curse. It's a blessing because you know a lot, right? And you know where to look. You can do the research. You can make sense of the numbers. You can, you have friends who are doctors. So even if you don't understand a test completely, you can ask a friend and they can guide you through it. So, knowledge is power. So it kind of helps you with the anxiety, but it's also a curse because of that 0.5% risk of this happening or that 10% risk of that happening. That may never happen, but you are aware of it. So, I think that when you are on the other side, right? When you suddenly become a patient or you're the parent of a patient, it's probably a good idea to sort of put that physician on pause and just be a patient sometimes. But then again, like I said, you also, that gives you a lot of strength in your advocacy, right? Because you, before going for the appointment, you know what questions to ask, you know what the resources are. You may not always get the answers, or you may not get the access to those resources, but you know the right questions. So I would say for the most part, it's a blessing, but yes, it's a curse too, because you worry about a lot of things that may never happen to your child, but they keep you up at night. I think it's work in progress. You sort of, go through those emotions, go through those feelings, and eventually you realize that, no matter who you are, you could be the best doctor in the world, but at the end of the day, there's this much we have control over, and the vast majority of the stuff that's going to happen to us in life, we have no control over. So you have to give that control to a higher power. So yeah. So for me, I think I think also I'm sort of an anxious person at baseline now because of all that has happened to us. But somewhere along the line, I have learned how to make peace with the fact that there's only maybe 0.5% in my life that I have control over. So yeah.
How old is Lena now?
She's 12 now.
12. Okay. And I'm curious, when you said, initially when you had that grief and you described as, as the death of a dream, how did you, I kind of want to know, for people who are listening, maybe going through the same thing, how did you transition from that grief to like, here, I'm this advocate of the person and for this person, and what helped you? I'm just trying to know more. Yeah.
So I think all of us, especially physicians in general, or anyone who's in a high achieving field, most of us are pretty type A, right? We're very goal oriented. Okay, now I have finished medical school, then I'm going to get into residency, then we're going to do fellowship or whatever you want to do, right? So we know we've already like decided the path for us. And I think it's not necessarily a good thing, but we tend to do the same for our kids, right? Okay, so my kid's going to go to this school, we're going to enroll them in these activities, and they're going to go to this college, and I'm South Asian. So I always, also before she was born, in my head, I was like, she's going to become this, So again, not necessarily a good thing, but that's the way we are. We're very type A. So I was the same. And, the best analogy people have given to me for special needs parenting is that, let's say if you booked a ticket to go to New York and you were like, okay, I'm going to go to Statue of Liberty, I'm going to go to Fifth Avenue, I'm going to go to here, and suddenly your plane gets diverted and you end up in London, right? Now, you've never been to London before, you don't know what to expect over there, you don't know where to go, but it's an equally beautiful city with great stuff to do, so you just have to just go do things as, and you don't have a guide, so you will do things, but you will do things in a natural way, right? So similarly, when we, again, my journey from being very broken to having it all together in my head was pretty fast, because I knew that I couldn't be a mess like this. But I realized, this is my kid. She's perfect. Her journey is going to be perfect. Whatever she achieves is going to be perfect. I never looked at all those diagnoses as a weakness for her. Yes, I mean, they do cause her hardships. They cause her family hardships. But these are the cards she's been dealt with in life, And we don't want to mourn the loss of something forever. Yes, for a little bit is fine. But after that, you celebrate the life that the person has. And again, I'm coming from my experience. So my experience is not similar to someone whose child is in a wheelchair, not capable of walking, or has a trach tube. So everyone is different, right? But I think the grief is the same. It's the same. So it's a mindset. You have to get over it and do whatever it takes to. You should have a support system. If you don't have a support system, talk to a therapist. If you don't have a there are resources there. So and then talk to your spouse. In this journey, what happens is that being the mother, naturally, as mothers, it's innate that we tend to care for our kids naturally, right? But in the special needs journey, if you take it all upon yourself as a mother, right, and you sort of alienate your spouse, because you think you can do it better. That's not going to work, you know. Of course, it can't be 50-50 all times, but it can be 60-40 or even 70-30. Both the parents have to be involved. And again, you know, there will be days, there are good days and there are bad days, but I think that's for all parents, right? There are good days and bad days. Maybe in special needs parenting, those bad days are exceptionally hard, but take it like it's life. You know, life will go on. You will go through these days. So earlier on in her life, I made a pledge. Me and my husband made a pledge that we're going to enjoy every day with our daughter. We're going to enjoy her being a baby. We're going to enjoy her being a toddler. And we're not going to compare her with anyone. Comparison is the death. It kills all the joy out of your life. And it's just not about parenting. It's everything, you know. So we and a lot of us have that app, right? I forget the name. I think it's called Pregnancy Center or something, but I had it downloaded. And when I was pregnant, it would send me reminders. Oh, you're this many weeks, you should expect this. And when she was born, I forgot to delete it, but Baby Center, yeah. But it would tell me reminders that, oh, your daughter's 6 months, she'd be sitting up now. My daughter didn't sit up till she was 18 months. She didn't walk till she was 5 years, right? So she never met any of those convention goals. So, but I didn't care really because I stopped comparing. So if I would tell you one thing that could be very helpful, it's do not compare. Let your child walk their path. They will meet their milestones whenever they want to, whenever they can. Maybe they'll never walk, you know. But success is something which we have made up in our mind that this is what conventional success looks like, right? But success can be anything. So you just have to think out of the box. And I think that's been the biggest gift for us in this journey. Like, we don't compare, we think outside the box, and we're happy with what we have.
Yeah. That's beautiful, and that's very wise too. I think you're a very wise person in the few minutes that I've talked to you. So I think it's gonna be. And I read that piece. I think about when I was researching for this podcast. I think it's the story by a poet. Like it was an essay where she says, "I'm going somewhere else," and I landed in Holland. And I don't know if you've read that too. And so I thought it was beautiful. What surprised you about the healthcare system now being on the patient side? And I think we all know that the healthcare system is really hard for patients, but you don't really know until you're in their shoes. So yeah,
absolutely. I think when we all get into medicine, I think the one thing that's common is that we want to help people. We want to give them our best. We want them to have the best care possible. We want to cure. We want to make their lives better. And that's the common goal, right? And even when you're in training, you're not really exposed to the other side of medicine because you're not responsible for prior auths. You're not responsible for dealing with insurance companies. So even in training, you have these rose-colored glasses and you're viewing medicine as this very noble, and it is a noble field, right? Because that's the main reason we're here today, to help people. But when you're on the other side suddenly and you have to fight with the insurance for a prior auth, your kid needs cochlear implant surgery and there's this one letter that is missing because somebody didn't mention that she was this many % deaf, and the surgery is not being cleared. Suddenly those glasses come off and you realize that it's just nothing more than a business. The patients are the consumers, we are the providers, and so we're just parts of this machine that is being run by corporate, and it is very disheartening, but you do your best. When like I said, I switched to the VA. I feel much more happier over here. I don't have to deal with insurance companies. I am here to provide excellent care to my patients. I'm not incentivized by anything. The only incentive I have is to provide good care to my patients. So unfortunately, I think what happens is as you stay in this system, you become jaded, right? So because my daughter has multiple medical needs, we see many physicians throughout the course of the year. And you meet some people who still have those values intact and they want to do the best. And then you meet people who are just like, you're just another number for them. So I think medicine is like any other business now. And we're just little ploys in this business, but it doesn't mean that you let go of those ideals. Like I said, I have physicians we've been seeing for the past 12 years, and they're like family now. And we used to live in Cincinnati before we moved to Houston, and I have them on text, and I message them if I have an issue, and they take their time, they respond back. They always ask about Lena. So, so I mean, it's a fractured system, unfortunately, and it's a system-wide problem, and I don't think there's this one solution to it. But you kind of see it for what it is.
Yeah. And something is like, I feel like when we are in clinic, or if you're spending time with a patient in the hospital, what you're seeing is such a snapshot of what they are going through. Really, sometimes I feel incompetent because if I'm meeting a child with a disability or a child with who's neurodivergent, and I'm kind of giving them advice on what to do because I'm a pediatrician, so I am supposed to be their doctor, but I feel like I really don't know the depth of what they are going through on day-to-day basis. So sometimes I'm giving them advice, but it may not be practical for them, and we don't have enough time for them. Did you kind of feel that, people are telling you things, but they don't really have no clue what's going on?
Absolutely, absolutely. I think that when you have a child with multiple needs, right? They need OT,
Yeah.
they need PT, they need speech, then they need behavioral therapy. That's like a gazillion therapies for 1 week, right? Now, this person who you're telling to take their child for therapy, they also have a job. They also have another child. So, but you're telling them that you need to do this. And they also then have to deal with an insurance company who may not approve all those visits, right?
Yeah.
So, I think physicians have the best interest at mind, but they don't know what the person's backstory is. You can dish out 500 therapies, but if the person doesn't have the time because they can't take off from work, right?
Yeah.
How are they going to take their child? So let me give you one example. So when Lena was 5, I think that was the moment in her life that everything changed, because she had a simple sore throat. I took her to the ER, and she was seen by one of the mid-level providers, and they told us that she had croup. And they gave her steroids. And then 2 days later, she got sick. She was very sick. So I took her back. My daughter was in septic shock. She ended up with multi-organ failure. And she almost died. We were in the hospital for 4 months. And she was intubated for 6 weeks. Now, this is on top of all that our family was going through. This happened to us when she was 5. It happened to her. And after being intubated and all those things, her teeth became like really bad. She had caries, her teeth need to be pulled out, so on and so forth. So after we got discharged, I took her to a pediatric dentist because she needed to have some gum grafting done. And the dentist walked in and he's like, "Ma'am, have you seen your daughter's mouth? Her hygiene is super poor. Does she not brush her teeth?" And this is me after being in the hospital with her for 4 months, right? I did not leave the hospital. I almost felt like what a war refugee would feel. I was seeing the real world after like 4 months. And I started crying. He's like, "Are you okay?" And I was just like, "Sir, did you read her chart?" Of course, the dentist did not have her chart, right? But I was like, "Do you know what we've been through?" And he's just like, he took a step back, and my husband was there, and he kind of filled him in, and he apologized. But so you don't know what somebody's backstory is. And I think after all of this, I treat everyone with a lot of grace. I have patients. Just yesterday, a patient shouted at me for 15 minutes for nothing at all. Of course, I didn't feel great, but in my head, I was like, I know he has a tough life. His ejection fraction is 15%. He's on these multiple medications. I'm not going to hold it against him. And despite the fact that it was not my fault, I apologized to him. Because I was like, if my apology is going to make him feel better, I'll do it. So I've let go of my ego. I started looking at my patients in a different way, their families in a different way. Now, back in the day, if a family member would ask me a gazillion questions, I was like, why are they so annoying? And I'm being honest with you. But now I'm like, they just want to be informed, just like I want to be informed. I'm probably the annoying mom to her pediatrician, but I want to ask all these questions. I want to know. So really, I think it's given me a great perspective. It's a blessing in that way.
Yeah. Has it, so you kind of said it, but it changed the way you practice medicine a little bit? Yeah.
It does. It definitely has. I'm just very patient now with my patients.
Yeah.
I just give everyone, not just in medicine, life in general, I give everyone the benefit of the doubt.
Yeah. Yeah. What was the experience of like being in the hospital? Probably really scary.
It was, I think the one thing in my life that has been life changing was that, right? And after that, the way I parent my daughter has also changed, because before that, I was still like very goal oriented, right? Because if they told us you need to do physical therapy 4 times a week, I would take her 4 times a week. On top of that, I would do speech. On top of that, I would do occupational therapy. So our house was like a therapy center, right? And I was just like, no, she's gonna do this. She's gonna, you know. And I never stopped and pondered, is she happy? I wanted her to succeed. I was just like, my daughter's gonna succeed. Success, it's gonna be success on her own terms, but she will succeed. So I remember the day that we got admitted to the hospital and we were rushed, airlifted to the ICU, because we were to the main base hospital at Cincinnati Children's. The intensivist came and talked to us, and she told us that, I don't want to lie to you, the mortality, she had sepsis with DIC, renal failure, everything you can think of, right? She said the mortality is in excess of 99%. So you can say that we were granted a miracle. We got her for the second time. And while I was in the hospital with her, I remember this one day very distinctly. Her numbers weren't improving. She ended up getting necrotizing fasciitis, compartment syndrome. She had to be taken to the OR. And I was sitting outside in the waiting room and I was crying inconsolably. And there was this other mom whose daughter had double lung transplant and renal transplant, and now her lungs were failing. So they were going the hospice route. And I would see her cry every day, but that day she was very calm. And she came to me and we became friends, right? When you are with someone for so many weeks, you become friends with them. And she's like, you're crying a lot today. I was like, I am. I was like, this is going on. I don't know what's going to happen. And I'm like, why are you so calm today? I just asked her like that. And she's just like, she's like, listen, my daughter could have been taken away from us when she was 8. At 8, she got her lungs, right? But God gave her to us for an extra 12 years. So I'm sad, but I know she'll be waiting for us at the gates of heaven. So I'm not going to cry today. And so I gained this whole new perspective on life. I met so many inspirational people, not just patients, their families, but doctors, nurses, physical therapists, therapy dogs. It was being in there for 4 months. By virtue of my daughter, I felt like I lived those moments. And after that incident, I really changed the way I practice too. And I'll tell you why. Because when I was there in the ICU with her, I was at the time in a different practice, and one of my coworkers called me and he was just like, Umara, you're on call tomorrow. Do you know who's covering for you? And I could not believe my ears, because here my daughter is almost dying, and this person has the audacity to call me and ask me who's going to cover my call tomorrow. And I just told him, I was like, you know what? I cannot talk right now. And I turned my phone off. But then I realized that I'm just this human body who is there to cover a call, right? And so now if there's a situation in which my family needs me, I put them first. Without compromising patient care, I put them first, because someone else will be able to fill that void at my work, but nobody will be able to fill that void at my home. So that was another life-changing experience that really helped me shape the way we live now as a family.
Yeah, that's awesome. And I agree with it. Yeah, there's so many people who can cover for you at work, but nobody at home.
Yes.
Is there one thing that with your experience in the hospital and now with your experience in the healthcare system, you wish doctors or people in healthcare would do differently? Is there like one thing that you wish, I wish they knew this or did this differently?
I think it's if I was not a physician, I'd have a list of 500 things that we could change. But I am a physician and I know the limitations, right? I know when we're seeing a patient, we're given 15, 20 minutes max, right? So But I think the one thing we can change is the way we present ourselves. In this journey, all the physicians we've met are great doctors, but some of them are great humans too. So if there's one thing as a physician we could change is our bedside manner. The way we talk to our patients. Treat them as humans who have a life story, who have a life, who are more than their diagnosis, um, who will leave your office and go back home and still try to do things for other family members. A child who is there to see you, who understands you, right? Who will think about those things that are being told to them. So I think developing humility, developing empathy, developing compassions, all the reasons we got into medicine for, which we lose along the way, we just need to,
Yeah.
we just need to have them more.
Yeah, that's beautiful. How do you combat, or how do you feel, there's so much misinformation around going on, politically, and about certain other diagnoses like autism, and, as a doctor, like, how do you feel about that?
It's definitely an uphill battle sometimes. I'm also involved in various community groups with special needs and in various cyber spaces. So there's always that anti-vaxxer campaign, and now with Tylenol, and there's always something, right? And I mean, I've never blamed myself for what has happened to my daughter, right? I mean, I don't think I did anything in my pregnancy or, ate something or, no. But there are women I know who blame themselves now, so it is I mean, I try to educate as much as I can, but sometimes you can't,
Yeah.
because, I also understand that these are parents who are trying to come up with answers, right? As humans, we do need answers that why did this happen to us? And of course, autism is on the rise now, whether it is being diagnosed more or if the prevalence has increased, but definitely we see a lot more autism. Also, I think one of the reasons is that people are not hiding autistic individuals anymore, so you see a lot more in the community. If I reflect back upon my own childhood now, I think I knew a couple of autistic people, right, who were called quirky, but I think they're just being diagnosed more. So yeah, there's a lot of misinformation, and people do come to me because I am a physician. They ask me, what do you think? And I just tell them that, I will still get my kids vaccinated. I have two kids, one's neurotypical, one is neurodivergent. Both of them got vaccinated, right? So is there an association? Yes, there's also an association. You'll be autistic if you ride a car, right? If you do something very often, there will be an association. But it's difficult to break it down for someone who doesn't have a medical background and also who's very much, deeply rooted in this beliefs, right? Because there's also, remember, if I'm a physician, there could be another physician who could be supporting those thoughts, right? So within the medical community, there's so much contradiction regarding these things. So yeah, but I do what I can, and I hope that people don't spread this misinformation. But when the government is leading it, then there's there's not much we can do, but we can speak
Yeah.
out.
Yeah, it's very disheartening. And as a pediatrician, I think we go through it a lot, and it's kind of, I think parents don't need to blame themselves. That's the big thing. They already, A, they're not to blame, and B, they're already carrying so much, that they don't need that extra burden coming from someone. And so, for anyone who's listening, Tylenol does not cause autism, but how do you struggle, something that you said and I thought of it, do you struggle and with the thought or any grief that you have now, of children fitting in socially, or, like, still, or you think you're way past that, or there are still some days, where you're like, oh, I wish, they did this or that?
No, I mostly feel very blessed in the sense that I've been able to move away there is social isolation, right? I think that's what you're referring to, both for the family
Yeah.
and for the kids,
Yeah.
right? You lose friends along the way, right? You lose friends because they don't want to include you because your child may be too noisy or so. Fortunately, I moved away from those people. I have a lot of amazing friends, family who support us. But yeah, with my daughter, me and my daughter like this. We could be twins, right? So what she lives through, I live through. My husband laughs at me. He's just like, why are you so involved in the politics of the kids on the street. I'm like, I'm not, but I do see it when kids ignore her. I do see that. Now, fortunately for my daughter, it's her superpower that she doesn't care, right? She's just very blessed. She doesn't really care. But it does bother me, and I don't think it comes from the kids. It comes from the parents, right?
Yeah.
Inclusion is not a choice; it's an obligation, and I am surprised that sometimes the exclusion, that behavior is coming from people who are very educated. Sometimes from fellow physicians who understand the ins and outs of it. And I don't think it has anything to do with the profession. It has to do with the kind of person you are, you know. So you can choose to be a good person and include everyone, and inclusion doesn't have to be that you have to be best friends with that child and your child has to, no, but if you're having a birthday party and you're inviting everyone and you're excluding 3 kids, it's not on your child, it's on you, right?
Yeah.
So we tend to lead a life in which I practice inclusion every day with my actions. My kids tend to do the same, my husband. But yeah, it does hurt you. It does hurt you that your child is just a diagnosis to many people, So, but what can you do? You can only change yourself. And maybe by virtue of seeing you, other people will follow suit. But a lot of times they don't. And I attribute it to their special needs, that they have a lack of empathy.
Yeah. How did you find your tribe, like the people, your support, your community, your resources, and anything that you can share with the audience, along the way that you went through this journey?
So, one of the biggest challenges of being a special needs family is the isolation, and it'll happen to every special needs family. You'll be isolated socially from religious places, different places. So you really feel it. You feel down in the dumps. And I once read this one thing, that when a special needs parent fell in a hole, plenty of people passed by. Nobody helped them out. The only person to reach out to help them was another special needs parent. So that was my tribe. Because my daughter was born profoundly deaf, we got involved with this community in Cincinnati, and they just became my family. I don't even know. I don't think they know this is how I feel about them. And some of them I just met a couple of times, but the amount of comfort with their words, the resources they introduced me to. When my daughter was little, my best friend was her occupational therapist who used to come through the county. And she would sit with me. And I remember one day I was feeling really bad. And she's like, Amara, what's wrong with you? And I was like, Jessica, I feel like I'm not a good parent. She's like, I know you are a good parent, Amara. I'm going to go now to this other house after you, who is a quadriplegic child because her dad smashed her on the ground when she was 2. So you are a good parent. There are plenty of bad parents, but you're not a bad parent. So she would say nice. So yeah, it's other special needs parents who were our tribe. And I would like to give a lot of credit and thanks to my parents. My parents are South Asian, and anyone who's South Asian, they will know that we are people who are stuck in a lot of stigmas, and special needs is a huge stigma. So my parents are like way ahead of their time. Whenever I would feel sorry for myself or for my daughter, they would tell me, you have a beautiful daughter, Amara. If you're not gonna be sorry.
That's okay.
If you're not gonna be thankful for her, you're actually, in their own, in Urdu, they would say that you're not thankful to Allah, right? So my parents and the other special needs parents were our tribe. They told me about resources no physician had told me about. And from the get-go, they were my tribe. Now I have become someone's tribe, So it's a growing community, and you meet all these great inspirational people that I would have never met them if I wasn't a special needs parent, right? Because we don't tend to get out of a little bubble. But yeah, so that was it. So initially it was this place called Ohio Valley Voices. Then we were in an AVA place. Now in Houston, we're part of this beautiful community called Daru Sakina, which is for special needs families. So we just keep each other strong. We motivate each other, and till date I'm asking other moms about, hey, where can I find this, or where can I do that, or they'll tell me not only about the resource, but about how to get them. No physician is going to tell you that. No social workers. Another parent will tell you that.
Yeah, I agree with that. Absolutely. Oh, but that's awesome. And I'm glad you can pass it on, right? Somebody helped you out, and now you can help it on. That's a gift. What uh, advice would you give to any physician, or I guess any parent in general? I know somebody who I've interviewed on this podcast, and I know they recently had a child who was diagnosed with a syndrome. So I was kind of thinking about them and, their doctors. And what advice would you give to anybody who's going through this?
Sure. I think hindsight is always 2020. When I look back on the past 12 years, there are many things I think we could have done better. But I think, honestly, when you are faced with a situation, you do your best, whatever was best for that time. But a couple of things do stand out. I think, first of all, if you are, in this journey right now, you could be at any point, you could be in the beginning, in the middle, you could be well settled. It's a beautiful journey. It is wonderful. You will get to lead your life in a way that is just amazing. You won't care about superficial things anymore. You won't care about these standards that have been set for us. You become you don't conform to the standards set by society. So it's going to be wonderful. I assure you of that. But one thing which I think kind of when I reflect back, I think everyone should know, especially physicians who are special needs parents. Now, when it comes to two physicians, especially who are special needs parents, if you look at the statistics, physicians as it is have a higher divorce rate. So it's very difficult to maintain a healthy relationship given our schedules, given, how demanding our professions are. So it requires work to keep your marriage healthy. And now on top of that, if you throw in another immense amount of stress, that's like the recipe for having a bad marriage, right? So work on your marriage too. I know it's natural to put that on the back burner because you're like, oh, I'll come back to it after my child finishes their therapy. No, me and my husband are lucky because we made it, but there were some hard times. At one point in time, I really resented my husband because I was like, he doesn't care. And the reason is because I never communicated with him how I felt, right? How is he supposed to read my mind? Right. But back in that frame of mind, I was just like, he doesn't know what I'm going through. And, men are men. I don't think he was that intuitive to read between the lines. And now that I reflect back, I was just like, we should have communicated more. Now, albeit we didn't have a lot of time to communicate, but, we should have taken the time out. So if you are in this journey, even if you're not a physician, do not ignore your marriage because you're partners in this. So coming back to my point, which I had mentioned before, make this a partnership. One spouse should not take the entire responsibility upon themselves. Of course, one person is going to quarterback the whole thing, but the other spouse also needs to be involved, involve family members who want to be involved. If you have a brother, a sister, an aunt, an uncle, or even friends who really genuinely want to help you out, don't push them away. Accept that help. And I think if you're a physician and you're in this journey, I wish they had a category of physicians with special needs children because we do need those, accommodations too. Because sometimes, I'm embarrassed to ask my colleagues for the fourth time in a week that I have to break away for an hour because I have an IEP meeting or I have to take my daughter to therapy. But be honest with your colleagues, right? Because your work, you spend more than half your day at work. If you can't be honest with the people you work with, and if they don't accept your honesty, if your institution does not accept your honesty, then their job is not for you. The nice thing about being a physician is if you want to work for 1 day a week, you can. If you want to work for 1 day, 3 days a month, you can do that. But your child cannot have a parent who can surrogate for you. So you have to be there. So don't take it all upon yourself. Also, another message I would give is that do not try to be in control of everything. The best example is that when you have a bow and an arrow and you are aiming for something, once you let go of the arrow, you have no control over where it's going to hit. So give it your best, but don't worry so much about the outcomes. Like I said, my daughter walked at 5 years of age, right? Her pediatrician had given her a walker. She had a wheelchair. We never gave up, but it didn't stop us from doing things. We still would go to parks. We would still go to pumpkin patches with her little cute walker. And I gave it away to someone, but whenever I see a child with a walker, it just brings me an immense amount of joy that their parents aren't holding them back. So success will come. It may look different for you and your family, but it will come and you just have to recognize it. So So like I said, it's a beautiful journey. You will become a beautiful human, but you have to let yourself become that human, right? Trauma can do one of two things. Either it's going to make you very bitter or it's going to make you an amazing human being, right? So the only way I think you can become an amazing human being is if you process through the trauma, so get therapy if you need, talk to people, be open about it. You don't have to hide behind this facade of perfection or whatnot. We are who we are. I'm not embarrassed when I go to a party. I call up my friends. I'm like, hey, can you please hide the dessert, because my daughter's going to gravitate towards that right away, and she's not going to have a good time if she can't get it as soon as she sees it. So be open. Yeah. So I think you got it if you kind of believe in yourself, your kid, and the rest will be okay.
Yeah, that was beautiful. I was thinking when you were telling me some of these things, like, did you feel like you had to put your career on the back burner a little bit, and did that hurt? Or you said, you're pretty at peace with that family comes first.
You're absolutely right. I feel like when my daughter initially got her diagnosis, my initial plan was that I will not work for 1, 2, 3 years, right? Because I was really emotional, and with all the therapies that were recommended, with everything that she had to do to be a candidate for the cochlear implant, it wouldn't have been possible because it was a
Yeah.
full-time job in itself. So I was like, I won't work. But I remember talking to a colleague of mine, and they're like, so, will you be at peace with yourself if you don't work? You spent all these years studying and then becoming a cardiologist. And so how is it going to make you feel 5 years down the line? Are you going to regret that decision? Are you going to resent that decision? And I think that for me, the mental stimulation I get at work is very important, right? That's part of my mental well-being too. So I was lucky enough that at the time I was in a place where everyone knew me, they knew my work ethic, and they were nice enough to give me a job at a community hospital with a more flexible schedule. And then, if my parents wouldn't have supported me at that time, my parents stayed with us for almost a year. If they wouldn't have done that, I would have not been able. But yes, I went from wanting to be an academic physician to just being by myself as a private practice physician. I had minimal interaction with fellows, residents. I enjoyed that teaching aspect when I was in training, and I wanted to do that, but I couldn't. But do I regret that decision? No. I don't think my daughter would have made all this progress if I would have put her needs on the back burner and put my career forward. But I didn't give up my career too, right? So I found a good balance, and I understood that, this is the balance that we have to strike, and I have to be happy with it. If anything, 20 years down the line, I will really punish myself if my daughter missed out on things that would benefit her. But I don't think I'll be hard on myself if I didn't give a few grand rounds. So it's a decision I made, and I will never regret it, and I'm very happy about it. And I think I would tell everyone, unless you have someone trusted who can take your kids to all those appointments, can take them to therapy, be there yourself, because therapy is only 5% over there. 95% of it you have to bring it home, so you have to be there. So even if you have to put your career on the back burner for a couple of years, it's okay. For me, like I said, it worked out that I was lucky. I was able to find a job that I could still work and be there for my kid. But if I didn't find that job, then I would have definitely taken a break.
Yeah. I think I have two more questions. I wish this could go on forever, but we're going towards the end. I think one question is, what changes do you think in the system, for these children who need all those therapies? Do you think there's something while you were going through the healthcare system was different? And I think the last question is, how is Lena now? And I think our audience wants to know, how is she thriving? But yeah.
So I think the health, and I think this is something pretty doable, right? You're a pediatrician.
Yeah.
I don't think pediatricians are financially incentivized that well, right? So we don't have a lot of pediatricians. And the ratio of, for example, developmental pediatricians is even lower. So if your child needs, for example, an autism evaluation, it could take up to a year before they actually get seen by a developmental pediatrician. And why is it so important to get that diagnosis? Because insurance companies will not approve many therapies unless you have that diagnosis. So a lot of people end up paying out of pocket several $1,000s getting that diagnosis. Also, I think the other problem is that when kids have complex medical needs, there should be a more, centralized approach in which you go one day, you get to see all the specialists, and you're
Yeah.
done. Your life shouldn't have to be, for the first 6 months of a child's life, shouldn't have to be to go to the hospital every day because you have another appointment.
Yeah.
So making it more streamlined for these families is very important. And how is Lena doing today? She is thriving. She's the most funny, the most smart, the most brilliant kid. She is just a pleasure, a joy. Everyone who meets Lena, they love her because she is so loving. And a beautiful quality of kids with special needs is that they have this infectious amount of love, joy, just just being very unconditionally loving and just loving everyone. So definitely she's a gift for us and everyone around us. She has her struggles with her health, but overall she's doing great. We are lucky to have a team that cares about Lena, and I hope that all kids with special needs have that. She's lucky to have family members, friends who care about her, who love her. But my hope and my dream is that every child has that. I when we see Lena, we see the greatest success of her lives. We see this beautiful, beautiful individual, and I hope every special needs child is viewed like that. So yeah.
Yeah. That was beautiful. Thank you so much. I think it was such an amazing conversation. I really enjoyed it so much. I wish we could talk more. And you have so much wisdom. I think I might now ask you for advice in the future because you're giving some great advice. We do have but thank you for sharing her story with us and your story. And I think it will be very meaningful for a lot of people who are listening. Like I said, I recently know about someone, so it's a very important topic, and people don't talk about it enough. But we have a tradition on this podcast. Before we close, I read a poem, and I want to share a poem by Mary Oliver, and it's called Heavy. It's about the weight we carry as parents, as physicians, as people, but how over time we learn to hold it differently. It's called Heavy. So that time, I thought I could not go any closer to grief without dying. I went closer, and I did not die. Surely God had his hand in this, as well as friends. Still, I was bent, and my laughter, as the poet said, was nowhere to be found. Then said my friend Daniel, it's not the weight you carry, but how you carry it. Books, bricks, grief, it's all in the way. You embrace it, balance it, carry it, when you cannot and would not put it down. So I went practicing. Have you noticed? Have you heard the laughter that comes now and again out of my startled mouth? How I linger to admire the things of this world that are kind and maybe also troubled. Roses in the wind, the sea geese on the steep waves, a love to which there is no reply. Thank you so much, Umara, for doing this with us today.
Thank you for having me. I appreciate it.